Good afternoon. Today I'll continue to be talking about the coronavirus and the latest updates and news. So the first piece of news I'd like to talk about is that Germans Chancellor Angela Merkel has expressed cautious hope that Germans will preventing the spread of the coronavirus from straining the health system and showing the infection rate, but warned that the numbers were no cause for abandoning severe restrictions on social contact and personal freedoms. So she has expressed that the latest developments can give us cautious hope, which is very good, but Germans should not take this as an advantage and now can be freely to go out on their own. Instead, they should always practice social distancing until we can be sure that the entire crisis has passed, which I agree, and I think this is a really good decision. So what Germany did to lower the death toll or help with the crisis is that German authorities have credited early planning, widespread testing, and a robust health system, which resulted in a low death toll, which is quite surprising compared to its neighboring countries. In Germany, only 2,000 people have died of the COVID, while 7,000 in Britain, 11,000 in France, 15,000 in Spain, and almost 18,000 in Italy. So clearly Germany is actually doing really well job compared to its neighboring countries because of these steps that they have been taking forward in. And the second thing I'd like to talk about today is that the CDC has been releasing early demographics of the worst coronavirus cases. So for the entire month of March, it went from 88 confirmed cases to more than 170,000 cases. So the CDC, or the Center for Disease Control Prevention, has compiled data from hospitals all across the United States. And so here are some of the data that it has collected. Approximately 90% of the hospitalized patients had one or more underlying medical conditions. Older men were infected with the virus. Older people infected with the virus were more likely to be hospitalized, and men were more likely to endure severe cases than men, and black people were hospitalized at a higher rate than whites. So the study also found that the hospitalization for COVID-19 have been significantly higher than for recent outbreaks of influenza. So there's been a lot of questions swirling around about testing and what is the actual risks for the population, but now with this information from CDC, you can see how you have using the data. If you have a really high risk, perhaps you're a man above the age of 70 and you have an underlying heart condition or a lung condition, then you are basically of extremely high risk at this time. So maybe it would be a better idea to stay home more and basically don't go out at all. Maybe don't even go out for the groceries. Just stay home because you have high risk. And using this data, I think we can try to understand more of what population the virus is targeting in the population. The third amount of news is that New York has actually shown better results, as it recorded 799 new deaths from the virus, which is a lot, but hospitalizations in New York have fell for another day. So while the state's fertility count has increased to more than 7,000, however, instead some data has shown that shrinking number of hospital admissions is in New York, but he warned against relaxing social distancing rules and others, as clearly we are at a really critical moment that if we take one wrong step at this time, I feel like it's going to be really critical, and maybe thousands more will be dead if we do not focus on these social distancing guidelines and more. The fourth piece of news is that It's really quick. So 16 million people have filed for jobless benefits in the last 3 weeks. So another 6.6 million people filed for unemployment benefits last week as the coronavirus outbreak continued. And so more businesses have shut down, veteran workers and recent hires in nearly every type of industry without a paycheck. So more than 16 million Americans have lost their jobs, which is more losses than the most recent recession produced over the 2 years. Another round of emergency measures will help the economy by the Federal Reserve, but more and more people cannot pay rent. Food banks are so crowded that the National Guard has called out. And so I think the only thing that we can actually do here is to just get out of this virus as quick as we can to help those poor people who really need the help who really need all the help that they can get. So that's it. Thank you for listening, and I hope you have a good day.